Dengue fever is a common infectious disease in Malaysia. There are 4 types of viruses. When one recovers from one kind of virus and catches the other virus the next time, his symptoms would become even more serious. People must carefully prevent the spread of dengue fever and maintain the sanitation of one's living environment.
Dengue fever usually occurs in tropical and subtropical areas, including Malaysia. Urbanization and the flow of populations has led to the spread of dengue fever to other countries. In 2019, Malaysia's dengue fever cases reached 130,000, 50,000 more than the cases in 2018.
There are 4 kinds of dengue fever: Den 1, Den 2, Den 3, and Den 4. If you have one of the virus, you would develop antibody for that virus, but you might still have chance to be infected with the other viruses. Usually, the condition would be more serious by then because a different kind of virus is attacking your immune system. If you have recovered, even if the mosquito bites you, since you no longer have the virus, you won't infect others with the disease.
There are 3 stages of dengue fever infection. It's the fever phase, the critical phase, and the 3rd phase of recovery.
From the 1st to the 3rd day, the patient still has a fever, and platelets are normal. The critical phase usually takes place on the 4th and 5th day. By then, the patient's fever has gone down, but his platelets start to decrease and the thickness of the blood increases. Complications usually take place in this stage, which is dangerous. The patient starts to throw up. He has cramps and cannot eat anything. Then he would discover that he starts to bleed easily. His gums would bleed and there are red spots on his body. If he has gone through the critical phase, at the recovery phase, the patient has slowly recovered. His platelets and white blood cells would gradually increase.
According to World Health Organization's advice, there's a high chance that the patient will have a high fever and body aches, including headaches. If one has dengue fever, one should seek medical attention at a nearby hospital.
Usually, we will see how long you have had the fever and other symptoms. We will draw your blood to be tested to see if there is dengue fever virus in it. If you need to be hospitalized, they will ask you to go to government hospitals. Some dengue fever patients have good appetite and can drink a lot of water and do not have complications. They can rest at home and just go to hospitals for blood tests. We do not yet have medicines and vaccines for dengue fever, so we need to prevent ourselves from being infected.
Processing solid waste and cleaning the gutters and using pesticides appropriately can prevent the growth of mosquitoes.
Especially on rainy days when water easily accumulates, we must change the water regularly to avoid the growth of mosquito.
Understanding dengue fever is the key to preventing people from getting infected with the virus.
There are many